Hello, this is Dr. Laura Taylor. Welcome to my channel. This channel is meant to provide general medical information. It's not meant to provide specific medical advice. Please do see your doctor or your primary care provider to obtain medical advice that's tailored specifically for your needs. At the end of almost every video, I will supply some spiritual information. This is my personal opinion. I'll talk about the books I've read. If you don't want to stay for that portion of the video, I will let you know once the medical portion is finished. And at that point, you can simply click away. But first, please do like and subscribe. And I haven't asked this before, but if there's anyone out there who has skills in making a YouTube channel more hip, more engaging, have really good abilities at editing, I would be open to collaborating. I am doing this just completely voluntarily on top of my other obligations. And as my viewers know, the YouTube channel could use a little bit of spark. So what I tell people is that I want you to treat this as a podcast. I do try to give some visual aids, but I do encourage you to read. Look yourself, do your own search. Okay, so let's get started. This is the third video on heart failure. The first video was a general introduction. The second video, I began some PowerPoint slides, which we're going to go over today. And then I'm going to continue with information. Heart failure is a huge topic, so I imagine we might be doing several episodes for heart failure. But let's get started. So I'm going to go ahead and share my screen. Okay, so you guys should be able to see recognize, classify, treat, and prevent. This topic is heart failure by myself, Laura Tigler, MD. I am a senior specialist. So the second video that we did, the last video, we talked about recognition and how to classify. So I'm going to go over these few slides that I did for that video. I did make a couple corrections. So sorry, there was a couple typos. Okay, so we have different ways to recognize and classify heart failure now. So we have stage A, B, C, and D. Stage A, many Americans fall into that stage. That's when you're at risk to have heart failure, full-blown heart failure. You don't have symptoms, you don't have the diagnosis even, you're just at risk. And then stage B is where a large part of my patient population falls. We also call it pre-heart failure. Many people have stage B. There are no symptoms. There are structural changes present, for example, stiff heart, or it might just be functional changes are present. So in other words, as I talked about in previous videos, each heartbeat, the heart has to pump out a certain amount of blood. And if it's weak, for example, structurally changed, it might not be able to physically do that. Functionally, it might not be able to physically do that for various reasons. And at the bottom here of stage B, I mentioned asymptomatic left ventricular dysfunction has a 5-fold increased risk of progression to stage C. And those patients are at risk for sudden cardiac death. Stage C is the patient either had symptoms of heart failure in the past and they've been corrected. We can correct that if the heart failure is due to hypertension, for example. Let's control the blood pressure. We can correct that, for example, if heart failure was due to a valvular problem, which we can correct in many cases, or the heart failure was due to a certain type of arrhythmia that we can correct. So stage C is if the person has had symptoms, even if they've been corrected, and if the person has symptoms presently. Stage D is advanced heart failure. The risk has increased between 1965 and 1989. Lifetime risk for heart failure was about 20%. Recently, between 90 and 2014, that risk increased to 24%. Approximately 1 in 4 people will develop heart failure in their lifetime. So I'm going to leave this screen on for some of the talk. I wanted to mention that 6.7 million Americans over 20 years of age have heart failure. 6.7, you can round that up to 7 million Americans have heart failure. The prevalence is expected to rise to 8.5 million Americans by 2030. 2030 is not too far off. You can round that up to 9 million. So currently about 7 million, and in 4 years, about 9 million. And then I wanted to go back to stage A. 33% of the United States adult population is at risk for heart failure and have stage A. 33% of adults have stage A. And for stage B, which I was talking about down here, anywhere from 24 to 34% of the United States population has pre-heart failure. So think of the stage A, about 1/3 of adults has it, and stage B, 1/3. So we talked about, let me move to the next slide. Okay, the definition, it is a clinical syndrome, so it is, it presents with symptoms, and then the doctor or provider can diagnose it if the patient has shortness of breath, fatigue, and leg swelling, for example, and or the patient has certain signs on their echocardiogram, whether they're structural or functional. We'll talk about that more later. And then there is a very good blood test for heart failure. If you are going to get a blood test for your loved one, is ask for the NT-proBNP, like boy, Nancy, Peter. There is just a plain BNP, beta natriuretic peptide, or BNP, boy, Nancy, Peter. But if the person is obese, which many of us are now, then it's not as accurate. It's more complicated than that, but I do recommend asking for an NT-proBNP. And last time we did review that there are now 4 different types of heart failure. Heart failure with reduced ejection fraction, that's less than 40%. And over here, heart failure MR-EF, heart failure with mildly reduced ejection fraction, and that's 41 to 50%. And then the other one is IMP in the middle, HF, IMP, EF, heart failure, improved ejection fraction, because like I said, we can improve heart failure. And then heart failure with preserved ejection fraction. And last episode, I did tell you the main categories of why we have heart failure. Heart failure can be due to conditions related specifically to the heart, and I mentioned earlier valvular. For example, moderate mitral valve disease or aortic valve disease. So do see your primary care provider or your doctor once a year or once every 1 to 3 years, and make sure they listen to your heart if no other doctor has done so. Just as an aside, you don't have to have a complete physical exam with every provider every time. Just as long as, like I said, your heart is listened to by a competent, credentialed professional once every 1 to 3 years, that's probably adequate to rule out valvular heart disease. Coronary heart disease, that's what most people are familiar with in terms of heart attack. Cardiomyopathy, we talked about that a bit with other videos. Pericardial disease, I talked about that a lot with the prior video, so please do review that. And arrhythmias, most commonly atrial fibrillation. Atrial fibrillation is on the rise in men and women, and it is a risk factor for heart failure. Heart failure caused by conditions related to the lung. Obstructive lung disease, that's like COPD, if a person's been a smoker or is a smoker. There is a small subset of the population that can get COPD and they've never been a smoker, not even a passive smoker. But for the most part, it's usually a disease of smokers. Restrictive lung disease, pleural disease, we talked about this a lot in the previous video, and pulmonary embolism. You can have acute pulmonary embolism or blood clot in the lungs, and you can have chronic pulmonary embolism. Other reasons for heart failure. It's a really, really long list, but I just narrowed it down to 4 kind of categories for you. Anemia, specifically iron deficiency anemia, that's a huge topic. We have a lot more information on that. I will have to do another video on that. Neuromuscular disease, deconditioning. So if you are a couch potato, if you don't exercise at all, you are at risk for heart failure. And anxiety, although it's not a separate cause for heart failure, it's just a contributing factor. And I can't really pronounce this one, but Takotsubo cardiomyopathy, that's a specific type of heart condition that is related to severe emotional distress. Okay, so I'm going to go back and leave these on the screen for you. Okay. And again, the heart failure with reduced ejection fraction, HFrEF, that's less than 40% for the EF, mildly reduced ejection fraction, 41 to 49%. I stand corrected. I shouldn't really say 50. Greater than or equal to 50 is a normal ejection fraction. So that's heart failure with preserved ejection fraction. And heart failure with improved ejection fraction, it was low, but now it's improved. Okay, so let's talk about the echocardiogram. So for that, I'm just going to point you right down here, the universal definition of heart failure. So it might be worthwhile asking your provider for a copy of your echocardiogram report. I really encourage you to research all of the various findings in there. You can point out certain things with your provider, but I want you to look at the EA ratio. That's capital E / capital A ratio. I want you to look at the capital E / lowercase e prime ratio. E prime is with a tissue Doppler. If it's stiff, the low tissue movement or low E prime equals a greater capital E / E prime. So it's elevated. So in other words, if the tissue is stiff, you're going to have a greater capital E / lowercase e prime ratio. So you've got to look at that. Generally, I find that the cardiology reports on the echocardiogram are pretty helpful. I don't have to dig too deep to find these various ratios, but I think it's important that you know that there is meaning behind all of the mysterious looking letters and equations on your echocardiogram report. You want to look for tricuspid regurgitation velocity. So how fast is the blood going through that valve? The left atrial volume index. So please look at that. Yellow highlighted, look it up. And another important one on the echocardiogram is global longitudinal strain. We order an echocardiogram with strain if high suspicion for heart failure with preserved ejection fraction. So for HFpEF, for heart failure with preserved ejection fraction, it is a clinical syndrome that meets the universal definition of heart failure with an ejection fraction greater than or equal to 50%. But in addition to, it might have various conditions causing the preserved ejection fraction heart failure condition. Infiltrative cardiomyopathy. So that's one that is really worth looking up. We have amyloidosis, sarcoidosis, and hemochromatosis. Hemochromatosis is related. I touched on iron deficiency anemia with heart failure. There's a connection there. If we have severe iron deficiency anemia, it needs to be treated quite properly to improve the heart failure. On the other side of the coin is the hemochromatosis. That's really rare, but that's where the person's hepcidin protein that is a gatekeeper to how much iron is absorbed in the body has a abnormality, and the patient keeps on absorbing all of the iron that the person is ingesting, and that's not good because we don't have a set way to excrete iron from our body. We do get rid of it in some peripheral type of ways, like through our sweat or sloughing off our skin cells, or even if we're a marathon runner and we strike our foot hard on the ground over and over and over again, we can kill some red blood cells in the bloodstream. But hemochromatosis can cause heart failure. Sarcoidosis, I think some of my patients would think of that as primarily a lung issue or even a brain issue, but it is a heart issue, and amyloidosis as well. We do have amyloidosis heart failure clinics. If you feel that you're not feeling well and the diagnosis is incorrect, or is the heart failure diagnosis isn't being made, remember that there are these different type of causes for heart failure with preserved ejection fraction. Valvular disease, I talked about that earlier, pericardial disease, and high output heart failure. Okay, so you might want to look up capital H2, capital F is in Frank, capital P is in Peter, EF score, H2F PEF. And that's going to help you if you have greater than 6 points on that score. That's highly diagnostic of heart failure with preserved ejection fraction. So the H stands for heavy. So if your body mass index is greater than 30 kilograms per meter squared, but I do want you to get away from set cutoffs. If you're close to 30, you should also consider giving yourself a few points when you're in that conversation with your doctor. The second H, because I said H2, the number 2, stands for hypertension. So if you have 2 or more antihypertensive medications, you should give yourself a point. So if you're very heavy, give yourself 2 points. If you have chronic elevation of your blood pressure that requires you to be on 2 blood pressure medicines or more, give yourself another point. And then the F stands for atrial fibrillation, F as in Frank, whether it's paroxysmal or persistent. Paroxysmal just means comes and goes. Persistent means it's there constantly. And you need to give yourself 3 points for that one. Okay, and then the PEF, the P stands for pulmonary hypertension. A lot of you might not know a lot about that, but the blood vessels in your lungs, pulmonary is just another way to say lungs, those blood vessels can have elevated blood pressure, and yet the rest of your body doesn't have elevated blood pressure. Or your arteries in your entire body have elevated blood pressure, and you don't have pulmonary hypertension, or you have both. So they can be unrelated or they can be related. But for the pulmonary hypertension, Doppler echocardiographic estimated pulmonary artery systolic pressure is greater than 35 millimeters of mercury. And that's small m, capital H, small g. Hg is just the elemental symbol for mercury. So if you have pulmonary hypertension, give yourself 1 point. If you don't know if you have pulmonary hypertension, you can look on your echocardiogram report or ask your provider. E in the H2F PEF score stands for elder, so the older person. So if your age is greater than 60, give yourself a point. Again, if you're close to 60, you need to think about that. And then F, another F, stands for filling pressure. So the echocardiogram, remember I was telling you about the capital E / small e prime? If that ratio is greater than 9, then you need to give yourself a point. So for this H2F PEF score, which you can look up online, and you can look up your own results, if it's greater than 6 points, it's very likely that you have heart failure with preserved ejection fraction. So obviously with this, you need to know your rhythm. Are you normal or do you have atrial fibrillation? You need to know whether the arteries inside your lungs have elevated blood pressure, and you can find that on your echocardiogram. You need to know your age, of course, and you need to know your E / E prime ratio. If it's greater than 9, give yourself 1 point. Okay, and then of course, know your weight and if you're taking blood pressure medications. Okay, so for the heart failure reduced ejection fraction, we use guideline directed medical therapy. We abbreviate that. Capital G, capital D is in David, capital M is in Mary, capital T is in Tom. And that's for heart failure with reduced ejection fraction. But just as an aside, we use some or all of these medications. We can use some or all of these medications in heart failure with preserved ejection fraction. But we have a lot of evidence that the patients who have heart failure with reduced ejection fraction, which is less than 40%, they should be on a medication called an ARNI, and that's a combination of an ARB, we talked about that type of blood pressure medication in many videos back, and sacubitril. So it's a 2-medicine combo drug, and it can be less expensive now. Before it was very expensive, but depending on where you go to find it, you can find a much less expensive version. Beta blocker, we talked about that in previous episodes. MRA, we talked about that in previous episodes, and that's like commonly like spironolactone. And then the SGLT2 inhibitors, and I did talk about that quite a bit in previous episodes. So this may sound alarming to you, but if you have heart failure with reduced ejection fraction, the guidelines are very clear that if we give you all four of those medications at once, I know that sounds like a lot, but we can reduce your risk of death by 73%. That's super powerful. So, and then you might make a case for starting two, and then a week later start one, a week later start another, but basically all at once you start these four medications. And like I said, it does have strong evidence in reduction of cardiovascular mortality. And we are supposed to start you on these medicines all together. I do want to tell you this, that I told you that when we use the medications together, the relative risk reduction is 73% of death. But the number needed to treat is 4. That's extremely promising. That's extremely powerful. So rather than being on the cautious side and not wanting to take those medicines that your cardiologist or your family doctor recommends, that there's such strong evidence with GTMT guideline directed medical therapy for heart failure with reduced ejection fraction that it only takes, we only have to treat 4 people to reduce the incidence of death by 73%. I have a few more details, but I'm going to save them for the next time we talk, because this is a lot of information. I'm hoping that you just, like I said, treat this like a podcast and just listen to it over and over again. Let me give you a few more tidbits. The impact of treating high blood pressure, targeting a systolic blood pressure of less than 120. Obviously, less than 130 is adequate. That's what we shoot for. But less than 120 is what we consider normal. It reduces the rate of heart failure by 38%. So if you do have high blood pressure, you do want to work with your provider or doctor and reduce your chance of developing heart failure or help improve your heart failure. So make sure that your systolic blood pressure, that top number, is 120 or less. That can reduce the rate of heart failure by 38%. For every 10 millimeters of mercury reduction in your blood pressure, the risk of heart failure is reduced by 28%. So remember how I told you that if you have heart failure, and there's a long list of causes, which I've shown you, but if, for example, your heart failure is caused by high blood pressure, then if you keep that blood pressure at a very stringent goal, like less than 120, you are very much improving your health and reducing your risk of mortality and morbidity, which is illness or sickness symptoms. So our target for blood pressure now is less than 130/80. There could be some exceptions. For example, let's say you're very elderly, very frail. You can't even walk 4 meters in 5 seconds. It's just, you can't do it. For whatever reason, you're quite frail. Then we might make some exceptions to that 4 medication start rule. And best prescription options for blood pressure include the thiazide diuretics, the ACE/ARBs, and the beta blocker for the heart failure patient. We want to avoid the calcium channel blockers generally with the heart failure patient. Diagnosis: if the EKG shows an LVH, left ventricular hypertrophy, which just means enlarged muscle of the left ventricle. That's one of the examples of a structural change, which puts you at stage B, heart failure. Okay, so I'm going to stop there, and this is the end of the medical information. So I'll go ahead and stop sharing. So if you don't want to stay for the spiritual information, this is the time to click away. But first, please do like and subscribe. So I wanted to go over something that Jesus said, a very simple saying. And so now I've told you before, I am a devout Christian. I had a unique spiritual journey, just like everybody does. I have written a book on my salvation experience, and I will show that to you in case you want to go to Amazon and buy it. You're Saved by Laura Tigler, MD. And it is excellently written, if I do say so myself. So obviously that is not fiction, that's nonfiction. And the second book I've written is purely to entertain. And you can go to Amazon and buy that. It's also available in many, many, many other places. I'm just saying a simple way to go get it. And this is fiction. There's no agenda there. It's just to entertain. So I hope you enjoy that. Like I said, just like you, I've had my own spiritual journey, and I've become much more metaphysical. I used to take a bit of exception at Thomas. I learned that Thomas Jefferson would cross certain phrases out of the Bible, and I was just shocked. Like, the Bible is infallible. It's the Bible. How can you discard certain things? So it's taken me many, many years to appreciate that there are things in the Bible that are not true, or someone or a group put in to actually mislead people or actually lie. I know this is very hard to hear if you're in the stage of life that I was in the past, but I'm going to give you an example. So when Jesus said, "I am the way, the truth, and the life," go to John 14 in the Bible, the Gospel John, chapter 14, about verse 6. When you're at a certain stage of your spiritual life, you might naturally just think that means you have to believe in Jesus Christ as the author of your salvation, which I do. Otherwise, you can't be saved. And it doesn't even really explain saved from what. We can go on about that in another video, but and then it goes on to say, "No one comes to the Father except through me." Okay, well, if Jesus said that, what exactly did he mean? So do you have to be Christian to be saved? Although other religions think they can be saved, like Hindus have a salvation theory as well, and Islam and Judaism. So what I've come to understand is that I am the way, the truth, and the life. I don't think it was referring to Jesus the man, because we now know that the universe is not just one universe, it's a multiverse. There's multiple dimensions. Whether Jesus Christ the Christ consciousness came into this world as just Jesus, or whether he came in other times like Adam, Enoch, Joshua, or he made himself known in other ways. Like I myself feel that I have had contact with Jesus through the Bible. Or, for example, angels. Those of us who believe, we know or we believe that angels can come to the earth. That's in the Bible. So we certainly can't limit God just by coming to the earth one time as Jesus. He may have come many other times in many other ways. So believing that you can be saved only by worshiping Jesus the man, that particular incarnation, might be a very narrow point of view. I have now come to realize that the I am in that statement is referring to the I am, which is God. And we know as Christians and in other religions that God is inside of us. Even Jesus said that the kingdom of heaven is within. So God is inside of us. You could think of us, human beings, this physical body that we have as like a car that we're driving, and we certainly don't want anyone else in that car, especially someone from Satan. That would be what you would hear of being possessed, or negative influences. We want to be just our God aspect driving this car. So we need to connect to that I am. And we have to, at some point, I believe, realize that we are part of the I am and take responsibility for that level of authority. And that will change your life, having that perception that you're sitting in this vehicle. But you might also think this vehicle is sitting within you, your God aspect, that it's just a vehicle. And so identifying yourself as, in my case, Dr. Tigler, a female, whatever other labels you want to put on me, is very maybe incorrect, because I'm really part of the I am. So I am the way, the truth, and the life. It's in my heart. So that's something I wanted you to think about. So I'll just give you this last bit again of information that please consider buying my book, You're Saved, An Impossible Situation, my second book. I'm writing a third book. And if you haven't already, please subscribe to this channel and please comment. I would love to hear from you. And I want to make this channel even more powerful and helpful. But please, for now, take it as a pretty good podcast. And then over time, I hope to make it much improved for you. All right, have a great day and happy Father's Day.